often I'm asked, when is it time to make an appointment and come in and be evaluated? And it really depends on the problem, the situation. There's acute injuries that occur, with a sports injury, working out in the gym or the yard, and someone feels a pop or hurts a joint, versus the other person where it's more of a chronic, ongoing problem, and over months and years, pains change. For me, I'll break it down into just different body parts. For like the neck and back, the most worrisome problems are numbness and tingling. And if you do something and all of a sudden you can't feel or move your hand or foot, those are pretty urgent needs, especially if it doesn't go away. If it's brief, you can kind of watch it, maybe give it a day or two, and if it doesn't improve, then get seen. But for the numbness and tingling that persists, I would usually recommend getting seen sooner than later. Shoulder, very common complaint that I would see. There's a very big difference between a sports injury and just someone who says, for 3 months my shoulder's been sore. For me, red flags would be weakness, loss of motion. If you go to the gym and you feel a pop and all of a sudden you have difficulty moving or lifting things, I would probably get that seen sooner than later. For the person whose pain starts to worsen over time and having difficulty sleeping, rolling over at night and rolling onto that side and waking up, that might be the time to get seen. But big red flags are weakness and loss of motion in the shoulder. Knee's another joint I would see often, and swelling often people recognize in the knee. Some swelling doesn't worry me as much as having an injury, knee fills up, and have difficulty bearing weight. Those are injuries I would see pretty soon. But same with the shoulder. If you start to notice loss of motion, weakness over time, locking, catching, those are things I would have evaluated sooner than later. Ankle injuries, that also are very common in sports and recreational athletes on the weekend or working around the house. If you can roll your ankle and bear weight, it's something you could probably watch for a little bit. But for the injury where you roll your ankle, can't even put weight on it, that's something I would probably get seen right away. For some injuries, if you decide to watch it on your own, most common treatments would be resting, treating with ice, elevating, maybe avoiding that activity for a bit of time. But I would say that in the first few days, you don't see a significant improvement, whether it's 1 or 2 days or 2 or 3. I certainly wouldn't give it a few weeks if you can't bear weight or it's just a swollen joint. But keep in mind, there's also medical reasons people have joint issues as well. You have gout, rheumatoid arthritis, and in this area we have Lyme disease, which can cause pain and swelling. So if you watch things for a bit, you don't really see much improvement, I usually recommend people come to see me, and I can rule out some of the orthopedic issues. And if those don't prove to show anything, then I start ordering some lab work to look into some more of the medical reasons. One of my rules is obviously you have to be able to walk comfortably and without pain before you try to go run. And you got to run without pain before you try to pivot, cut, like in the sport, like soccer, tennis. But if you can't do step one, you really should, like in terms of walking, you should move on to the running. If you can't run without pain, I wouldn't move on to the cutting and twisting in full sports activities. So for most injuries, I would say, look, watch it on your own. If you don't see much improvement in the first few days, you can always come in and get it evaluated. The most severe injuries are ones that people recognize pretty quickly. Difficulty bearing weight, difficulty moving a joint. When a joint locks up, whether it's your knee, shoulder, elbow, there's usually a reason, and those are ones that you would want to get seen sooner than later. Obviously, there's lots of injuries that aren't emergent or urgent, but they're just difficult to live with. It makes it hard to exercise, and if you rest on your own, you don't see much improvement, it might be time to get looked at.